Welcome back to Hello Nigeria. It's time for our top story. Now, as Benga mentioned a while ago, on Tuesdays we look at topics that concern your mental, emotional, and physical well-being. Today we're stopping at your physical well-being, something that happens to plague a lot of people, young and old. We're looking at appendicitis, and no better person to discuss this with us than Dr. Andrew Iweme, who is a medical practitioner at Vita Clinic. Thank you so much for joining us.
Thanks for joining us, Dr. Iweme.
Andrew. Okay, I think first of all, let's start by bursting some myths about appendicitis. Some people say that there are certain herbs that can cure appendicitis. Is that true?
Well, we in the medical field, we try to avoid any relationship between, orthodox medicine and conventional medicine. So we stick to what we know, what we've learned, and what science can prove. For herbal concoctions, we really don't prescribe those. We recommend our patients not to take them because there have been some associations of complications of kidney problems and so many others.
Okay, now let's start with the big question. What is appendicitis?
Appendicitis. That's basically the inflammation of the appendix, and the appendix is a very tiny organ just located at the end of the large intestine.
What's the function of the appendix?
Yeah, that was
appendix.
Exactly. So some research have said the appendix contains lymphoid tissue, basically cells that help in immunity. Some research have said it helps in rebooting or refreshing the entire digestive system after a diarrheal disease. Some others have said it's just redundant tissue, it has no function, you can live without it. So in that situation, some surgeons, when they go into the abdomen for another surgery, they just take out the appendix.
So it doesn't cause trouble?
No, it doesn't cause trouble. You can live without it, basically.
Oh, wow.
Yeah, so now I understand better, because I used to hear people say stuff like, oh, this appendicitis thing, you live with it all your life, but sometimes it just gets inflamed. Now we understand that actually what they mean is that one has the appendix all through their lives, but at some point it could get inflamed, just as it is with prostate cancer, where the person has a prostate for all their lives, but at some point it could get inflamed.
Yeah.
Now, at what point should one be worried that they have appendicitis? We know usually there's always a side of the stomach. They say if you're hurting in one side, it's hernia. If you're hurting on another side, it's appendix rather. Which of them is the side for appendix?
Appendicitis.
That's the short form.
Yes, appendicitis is the disease. Yes. So the appendix is the organ.
Yes. So at what point do you know there's a problem with your appendix, and at what point do you know it's hernia? Which of them is appendix? Which one is the hernia side? And what are the symptoms of appendicitis?
So for the symptoms of appendicitis, primarily the symptom is pain in the lower right side of the abdomen. The lower right side of the abdomen, because that's where the appendix is located, just above the hip. All right. Sometimes this pain can start in the upper middle section of the abdomen. That's where the stomach area is and the pancreas. Then it migrates down to the lower right side of the abdomen, because that's where the appendix is. You can have fever. The patient can have fever apart from the pain. Fever, which is a sign of infection. They can have difficulty passing stool due to obstruction, because obstruction can cause the appendix to be inflamed. Can also have diarrhea. There's a variety of symptoms. They are usually non-specific, but the primary symptom is the pain at that side of the abdomen. When the doctor examines the patient, it can elicit a certain degree of tenderness. If you want to touch that area, the person guards. You know that there's something going on there.
So what causes appendicitis primarily?
So appendicitis, primarily, it's caused by an infection of the appendix, which causes it to be inflamed. So basically...
What causes the infection?
So it could be due to obstruction, blockage from stool. It could be due to, if there's a cancer around the colon, that's the intestine, that can cause blockage to the appendix. If there is any other infection in the abdomen, that also can spread to the appendix and cause some infection.
Now, we know usually when we hear of appendicitis, people have to undergo an appendectomy, I think. That's what it's called, to take out the appendix. Is that the final, is that like before that, is it possible to take medication to help prevent the inflammation or deal with the inflammation? We know that the final bus stop is that it has to be removed surgically, but is surgery always the option?
Well, it depends on the type. So clinically, we can divide appendicitis into two. That is subacute appendicitis and the acute appendicitis. With the subacute, you can take antibiotics, rehydrate the patient, give some IV fluids, then observe the patient. But with acute appendicitis, you must take out the
it's
the
gone
appendix.
beyond the state of
Yes, it's
managing
gone. Yes. So that's the surgical management for acute appendicitis. Then you can do what we call conservative management for the subacute by giving antibiotics, observing the patient, rehydrate the patient, fluid therapy, and continuous monitoring.
And why would you want to keep something that is not
Because many people are afraid of going under the knife.
Yes.
You just don't want to be caught on any part of your body.
You have a scar. Although there are two types of surgical procedures that can be done. Now with the invention of technology, there's what we call keyhole surgery, or what we refer to as laparoscopic surgery.
You don't need to open
you don't need to open
exactly like a cow.
It's non-invasive.
Yes, it's minimally invasive. So some centers do have equipment for that type of procedure.
In Nigeria?
Yeah, here in Nigeria.
Okay.
But it's quite expensive. The technical know-how of operating such equipment is limited to certain specialists.
Who have been able to go get trained.
Yes, who have been able to go get trained outside the country and all of that. So with that, there's less complications. Downtime is limited as against being cut open entirely. But if the appendix is ruptured and infection spreads into the entire abdomen, you have to cut open what we call a laparotomy. So you have to cut open the person and be able to drain what we call gastric lavage, be able to clean out the abdomen because infection would have spread,
Wow. That's not a pretty picture to paint.
And can that lead to death? Because I once had a friend in university who had an appendicitis. Her appendix was inflamed. She had appendicitis but didn't know what it was. She had been in the hospital for hours. Or she went home, they gave her medication. Of course, we know there's certain hospitals that are quacks. And sometime in the middle of the night, at about 2 a.m., she was screaming terribly. Rushed to the hospital and realized that it was appendix and it had ruptured. So if she had stayed a little longer, do you think it could have... She
survived?
She did. She's okay. She's married now.
Oh,
so do you think it will have
Thankfully.
escalated? Can it lead to death if not being contained properly?
Yeah, well, like you said, in that particular scenario which you painted, if the appendix ruptures, then it becomes, a surgical emergency. The person has to have the appendix removed. So complications like ruptured appendix, which can cause what we call generalized peritonitis, where the infection affects what we call the peritoneum that covers the sac that covers the abdomen. So in that situation, yes, it can, death is an imminent complication.
Is there an age group to people that are susceptible to appendicitis? Can children have it, and can older people have it?
Yeah, children can have it.
And pregnant women too.
Yes, pregnant women can have it as well because the growing fetus can cause obstruction to the appendix. In terms of age groups, the expected age group we see commonly is between the ages of 10 and 20 to 30 years of age. But lower ages, 2, 5, and that group, we don't see much of it.
Can you escape it after a certain age?
Escape?
Yes. like if you clock to 40 and then you've never had it.
If you clock
like 40 or something.
No, you can still get it.
At any time.
You can still get. It can still happen at any time. Oh.
So your grandmother can have appendicitis.
Yes, it can happen at any time.
Okay. So when a pregnant woman has appendicitis, what happens?
Well, it's a complication and it has to be taken out.
Wow.
So there's a decision of, the mother is there, the baby is there, the appendix is causing problem for both the mother and baby. So depending on the age of the pregnancy, then you counsel the couple, that's the pregnant woman and her spouse or partner, as to what surgical intervention will be necessary and how to affect continuing the pregnancy.
Yeah, they often say prevention is better than cure. And we haven't talked about preventive measures, or is there absolutely nothing you can do about it? lifestyle choices? How do I ban the spirit of appendicitis from my life?
Well, in terms of prevention, if appendicitis is going to happen, it's going to happen.
So are there any risk factors, anything that can influence it happening?
Yeah, so there are risk factors, primarily just one in terms of diet. So diets that contain high fiber, that can help cereals, oats.
Well, we eat fiber because we're trying to stay in shape. And they tell you that fiber is good for breakfast.
Fall back on amala.
No way.
Yeah, so cereals, soya, things that will help, intestinal movement to avoid or limit obstruction. So that's what we usually recommend.
They are actually good.
Yes,
they are great then. Nice. Okay, that's great.
Also, yes, eating them is helpful.
And then
it
water?
Reduces water, the fruits, vegetables. Wow. Everybody says suya. So fruits and vegetables as well, they help in movement within the intestine.
Oh, you said soya or suya?
Soya.
Oh, soya. I thought it was suya.
No, I didn't say suya. I said soya.
All right. Now, for those who are afraid that they have appendicitis and have probably gotten, that word from the doctor, how scared should they be? And what is the recovery time after a surgery has taken place? The average recovery time. Yeah,
as mentioned earlier, it depends on the type of surgery that is done. If it's the keyhole, the minimally invasive one, or the open type of surgery, and the complications or the stage at which the appendicitis had occurred, if it had ruptured or versus if it hadn't ruptured. So if it hadn't ruptured and it's an acute appendicitis, we expect recovery time between 6 weeks, that's about 2 to 3 months, 6 weeks to 8 weeks. So that's what we usually recommend.
And are there any things, that's a long time, are there any things that family members and loved ones of these people who have just come out of a surgery, what are the things they can do to help? The do's and don'ts to aid speedy recovery?
Well, limitation of movement, because you don't want, there are sutures on the skin, and you don't want the sutures to break. So we advise that movement is limited, no heavy lifting, the diet should be controlled. So if the surgery is done, the open process, then the amount of food that it eats is limited. So that's what we call oral graded sips. So it initially starts with water, then pap, then before you upgrade to the gradual process until you get to solid diet. Depending, because the abdomen has been invaded, so that upsets a lot of the natural pattern in the intestine. So until what we call peristalsis, that's movement within the intestine, resumes fully before you can.
And that is signified by them using the toilet.
Very important factor.
Thank you so much for speaking with us.
Thank you.
We've been speaking with Dr. Andrew Iroma, a general practitioner at Feta Clinic. Now, if you want to ask him questions or follow him on social media, how can people follow you? I'm
on Instagram only at Dr. Andrew UGO. That's DRANDREWUGO. And the clinic, Fetal Clinic, FETALCLINIC, Fetal Clinic on Instagram. So you can follow him, ask him all the questions you want to ask in this regard and maybe beyond. Now we have some amazing giveaways. Our station will be 3 in a few days. It's our celebration week, and we're giving away Zaron goodie bags. We're giving away cartons of Indomie and Hypo. Now if you want to win, you might stick around, because in our next segment, we'll be asking you a question, and the first 5 callers to calling get to win these giveaways. Stick around to find out what the questions are and get your phone loaded if you want to be a part of this. We'll be right back.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love am.